Relentless sounds of missiles, thousands living on the streets, and hospitals over capacity with wounded children. Those are just some of the tragedies a local surgeon witnessed in Gaza while on a medical mission for the past 2 weeks. Manisa Danabalan sat down with a doctor and has more.
You see the destruction, you see a huge amount of population taking refuge in the streets, setting up tents, plastic tents, no stores, no groceries, nothing.
Dr. Anas Al-Kassem was one of 6 surgeons from Canada and the U.S. who worked at 2 of the hospitals that are still functioning in Khan Younis. He says what we see on the news every day is just a portion of the reality many are facing. Al-Kassem says 20,000 people took refuge in each hospital to stay safe, but the hospital can typically only hold a capacity of 500 patients.
You discharge a patient, let's say you have a patient, you did a surgery, he's doing or she's doing fine, but they tell me the patient where I'm going to go. What do you mean discharge? They're just going to go down to the tent beside the hospital. They're going to go down to the basement or the floor, in the main floor where they, just put some mattresses, and that's their home now.
He says what he will remember the most are the moments when there was an influx of injuries, particularly children, after an airstrike. He says because there were limited resources, they had to make difficult decisions.
You have to make a decision who you're going to be focusing on and who you're going to ignore, unfortunately. And that's the most difficult decision as a human being, but as a physician as well, which we don't, thanks God, we don't face in Canada.
He says they could hear airstrikes as close as 200 to 300 meters away, and they didn't feel safe despite being told they could work at those 2 hospitals.
You hear the sounds, you hear the bombardment, you hear the airstrikes, you hear the drone all the time, 24 hours. But you focus on what you came for, you focus on the patient care, and you feel more comfortable that way.
He says the people who are suffering the most from this war are children, and he's asking all governments to push for an immediate ceasefire.
Whoever did not call for a ceasefire, I really ask them just to go there for 1 day, spend 1 night in Gaza and see the suffering of the kids, and the hunger and the displacement and how they're living in plastic tents.
The team was organized by the World Health Organization, but it wasn't funded. The 6 surgeons traveled at their own expense and volunteered their time without knowing whether they would come back home.